If you look at Oklahoma in January of 2020, you see that we were fighting the epidemics of opioid, methamphetamine, and then our worst, most historic epidemic of alcohol. And then all of a sudden you start hearing about this new virus that's in China.
Breaking news tonight on several fronts on the coronavirus pandemic.
Breaking developments in the coronavirus pandemic. The death toll rising in the U.S.
Breaking news tonight, America locked down.
Following the president's address last night, financial markets plunged again today.
Today's order from Governor Kevin Stitt will now make things a little bit tougher for even more businesses here in Oklahoma.
We are feeling the economic impact here in the metro and across the state.
You look at the long-term impacts of COVID-19, like any natural disaster, go well beyond the actual effect of the disaster itself. They really last for years in terms of mental health crises faced by individuals who are adjacent to the disaster, which in this case is all of us. The trauma and the stress associated with that, coupled with the economic downturn, is a perfect storm for addiction.
We had already really high rates of substance abuse, and the coronavirus is going to exacerbate those problems. We know that we lose over 300 Oklahomans a year to opioid overdose already.
We really are forecasting between 130 and 350 more opioid-related addiction deaths in Oklahoma over the next 12 months, somewhere between a 50% increase in opioid deaths and more than doubling opioid deaths.
Is pandemic levels of death related to addiction.
This isn't just a public health crisis. It is going to trigger an economic crisis. It's going to trigger a mental health and substance abuse crisis.
The consequences of this pandemic will be severe and long-lasting, and I think the next phase of this epidemic will be mental health and substance use. Oklahoma is going to be dealing with the addiction and mental health consequences from this for generations to come. We know that addiction doesn't come from a vacuum. And we know that when people are under stressful conditions, that they use substances.
Quarantining right now in the time of COVID-19 is absolutely essential for saving lives. Sheltering in place, staying at home is crucial. But that does have additional effects that we just need to be aware of. And one of those is isolation.
We have a pandemic where the number one recommendation is don't be around anybody. I can't think of anything more harmful to people in recovery.
A lot of the things that we want our patients to engage in and do, obviously they can't do. So we want them to have structure, we want them to have the schedules, we want them to connect with their 12-step support groups or their Celebrate Recovery groups or Dharma Recovery. So obviously when you can't go out and be amongst your peers who are so vital to recovery, it creates significant problems.
And then if you look at people that are already addicted, but they're in stable recovery, that those people will always tell you that boredom is a trigger. Idle hands does the devil's work, and those individuals are going to be more likely to use substances.
I started reaching out to these people and individuals and talking with them. There's one guy that stands out, and he wouldn't answer for over a week, and then we got into the corona. And I finally got a hold of him, and he said, I'm sorry, John. I said, what's going on, man? Why haven't you been talking to me? He got depressed. He was upset with the choices that he made. And now, his thing was, I'm going to go right back and get some counseling, get help. Well, it wasn't there. Another trigger to this addiction is stress. How are you going to cope? How are you going to deal with your feelings and emotion?
When people are stressed, they use drugs. They try to feel different because the reality isn't that great. And so a common way to combat that feeling is to drink something that brings you down, like alcohol, right? Or to use a substance that may bring you down, like an opioid or a benzodiazepine. Tell yourself, I just need to take the edge off of it. Well, it's a slippery slope.
The addictive chatter that our patients experience, they'll start to wonder, what's the point of being sober? They'll start to wonder about who can reasonably shelter in place and be sober at the same time. On the one hand, you've got this chatter sort of saying, why bother? What will a few hurt? And you've got this other part that's saying, you remember when and how nice it felt and how calm and peaceful and relaxed. And, you know, I'm seeing a lot of that sort of addictive chatter kick up in the minds of my patients.
This is where it's been, you know, really tricky as a healthcare professional. The focus has to be on, you know, saving lives and protecting the health and safety of Oklahomans. That's been our charge the entire time, not just the health impact, but the mental health and addiction and how economic loss plays into that. But we're also watching unemployment claims. Yesterday alone, they doubled. They were around 13,000 yesterday.
The stock market in free fall, the Dow plunging over 2,000 points, the worst day since the 1987 crash.
Millions of Americans facing the start of the week without a job.
Bars, movie theaters, and gyms will have to close by 8 p.m. tomorrow evening.
Stunning numbers, 30,000 Oklahomans out of work over the past 2 weeks. With that many people looking for help, delays and frustrations growing.
The correlation between economic downturn and substance use is historic. It's well known, well documented. Oklahoma is now facing the combination of two incredible economic devastating events. We've had the pandemic, which has really hurt any place that relies on a steady customer base. Aside from that economic downturn, we've had a calamity in oil.
CNN breaking news. Oil prices have turned negative.
For U.S. crude oil made history when it finished deep into negative yesterday.
Because of COVID-19 and the low prices, 10 to 20,000 Oklahomans are predicted to lose their jobs in the next few months.
Without the isolation, without the loneliness, without the trauma, just the economic factors, Oklahoma's looking at a rise of an additional 13,000 of our family, our friends, our neighbors, our coworkers who are going to struggle with substance abuse disorder.
When you look at oil recently trading negative, and just the substantial impact that has on our economy. We've got over nearly 50,000 workers actually employed in petroleum extraction here in the state. We really are specifically concerned about that workforce.
So there's a lot of causes that lead people to use substances in the first place, and all of those are made worse 100 times over by this global pandemic.
Investing in access to treatment now, and a continued investment in access to treatment, to education, to prevention, all the things that entities like FATE, Fighting Addiction Through Education, and other partners are doing across the state is crucial. And that investment at a difficult economic time has to be stepped up as well.
The same way we're having to address the public health crisis, we've put money into testing, we've put money into contact tracing. We're going to have to do the exact same thing for mental health and substance abuse.
The state government relies on taxes from oil revenues, and so if we're not selling oil, then we're not making tax money. That tax money is used to fund higher education, healthcare, mental health care, and substance use. And so I'm very, very worried that at the time we need addiction treatment the most, we're going to cut resources to that.
There are so many things we can do, though, to work towards preventing or intervening in this disease.
Number one is everybody needs to just stop and take their own pulse. They need to find out how this pandemic has affected them, especially if you've been involved in the response to the pandemic. And you may not stop and realize the damage that it's taking on your own mental health well-being.
This is a fatal condition that requires treatment, and so I would encourage individuals who need help or families who are trying to seek help to keep pressing. And I want everybody who needs to be in a treatment center to find a treatment center where they can be.
I mean, even as I was here working, I learned that someone who I had been close to in the past overdosed on opioids. And, that's pretty tough. The individual never reached out to anybody.
There is help right now, even during this crisis. There's multiple ways you can access help. Checking the Department of Mental Health and Substance Abuse website for the state of Oklahoma, there's a treatment locator, and you can actually access treatment locations across the United States from that website.
And every single person in Oklahoma that we can prevent from getting addicted, that we can help once they do get addicted, will not only save that person and make dramatic changes in their life trajectory, but it will also change the outcomes of future generations.
So we've got isolation, we've got economic downturn, and we have a state that was already vulnerable to the issue of substance abuse disorder. And that means that we have got to be a state that steps up to really continue to address these issues, because the problem is now, over the next at least 12 months, if not longer, going to get worse.